Here at Whisper Hearing Centers, Megan Schnellenberger is with us, and she's an audiologist here. Thank you for joining us. You know, this is a hot topic for me. COVID, people staying in, canceling appointments, your hearing is important. How would you suggest, and why would you suggest, get your hearing checked?
Right, it is. Hearing health is part of your overall health, and it usually falls to the bottom of the to-do list.
Yeah.
Because it's easy to ignore. Usually when it happens, you know, your hearing decreases gradually over time. But that's not to say it's not important and shouldn't be addressed. 2020 was weird with COVID because a lot of the situations where either patients or their loved ones would have noticed that you had an issue or maybe the hearing was changing, you're not engaging in those situations. You know, there's no going out to dinner, or there's minimal going out to dinner with friends or family, the family get-togethers, those social scenes, and being in the workplace. If you're in meetings or group settings, those are usually the biggest instances where patients or the people around them notice. You know, from a patient perspective, they might say, gosh, everyone's mumbling these days, or I can't understand, I wish Jerry would just speak up. Whereas Jerry sees the patient and says he is either answering inappropriately or he seems like he just doesn't care, because a lot of times, you know, you're withdrawn or not.
Right. And I know that now I don't have to hide it anymore, thank goodness. Hi, I'm Patty, I have a hearing disability. Fine, let's move on. But also, when I was hiding it and trying to compensate for it, I mean, that's very, very, very stressful.
Sure.
So it affects your mental health as well.
It does. Untreated hearing loss, and it's nothing that happens overnight, but over time, when you have untreated hearing loss, it leads to increased cognitive decline, depression, anxiety. There are more studies now that show, you know, the loneliness that results from untreated hearing loss has a significant impact on your physical health. Don't be afraid to call. We're nice. We want to be your friend. There's no shots. There's no blood draws. It's nice. It's nice. And so you come in and we'll chat with you about your case history. You know, if you have any family history of hearing loss, if you have a history of ear infections, you know, your ears are ringing, any balance issues. Kind of there's a questionnaire that we'll ask about your hearing. Then we'll go ahead and pop you in the booth and just do a test to see how loud you hear the beeps and how clear you hear speech. And then we'll go over the results with you. It's important for everybody to have at least a baseline hearing test. And a lot of times patients push it off because they say, you know, I don't want hearing aids, or I don't want to. It's a lot of unknown. And the hardest part is just making the phone call. And then from there, we take over and it's easy. But even if you aren't sure if you have a hearing loss or not, having a baseline test is important, so that even if we say, oh, you know, your hearing looks pretty good today, and then 2 years from now or 6 months, and you say, maybe I'm struggling a little more, we have something to compare, you know, A and B with. So, and we won't force you to do anything you don't want to do. You know, you don't have to get hearing aids, but addressing and being aware of your hearing health is an important part of your overall health.
I like that. Hearing health. Okay, call Megan. She's waiting for you to call.
Yes.
Or go to your website. There's another place there that
you can
you
schedule
go
from
and
the
get some
website.
information. Do not be afraid. It's a good thing. Trust me, you'll be hearing much more. Thank you very much.
Absolutely.
Well, we'll see you next time.
Absolutely.
We have an announcement to make too. Oh, baby, stay tuned. More on Megan's announcement coming up soon on Great Day TV.